What is monkeypox? Member of the orthopox virus family that includes smallpox, that many of us are familiar with, and orthopox, and several other animal pox viruses. So it's in that family. It is commonly seen, it's more commonly seen in countries in West and Central Africa, where the transmission goes from animals to humans. But in general, it's a tropical virus pretty much limited to Africa. And the only cases where it's been seen in the United States are when virus is imported. And there was a case in Texas a couple of years ago where those imported animals then affected and infected other laboratory animals. So for the Western Hemisphere, unusual. What's going on here? And why are we seeing this? What really amounts to a new method of transmission, something that's not been observed before, this person-to-person way of spreading virus. And the question is, has the virus changed? What else is different that contributes to this? Some people say that climate change changes the way animals behave, where they live, and may have something to do with the way some of these infections are spread. I can't go any farther than that because we just don't know. But the point is that people were smart enough to recognize this new way of spreading virus and put us on the alert. And that's really what this is about. We're all on the alert here, looking for it, managing it, trying to stop the spread before it gets to be a much bigger problem. I'd say viruses like this are unpredictable, so we really don't know what's going to happen. On the other hand, the best course of action for now is to be on the alert. And that's the advice that I would give to my patients, to my friends, and to my medical colleagues, is be on the lookout. The big feature is a rash. And with this current outbreak that we've seen, the rashes tend to be in the groin, around the rectum, on the trunk of the body, hands, face, either one small lesion spot or several of them together. The other thing that happens with monkeypox infection is that people do get sick. They may have fevers, fatigue, muscle aches, and lymphadenopathy or swollen glands in either the neck or the groin. It takes about 2 weeks for the it takes about 2 weeks for the infection to resolve. It is what we call self-limiting. In other words, it sort of takes care of itself because there really isn't any specific treatment for this virus. So patients wait it out. I would consider it a serious condition if I had it, because there'd be concern about spreading it to others. The other piece is it makes you sick, and I'd rather be healthy and productive than be in bed sick. So we want to stop spread. The other thing that happens with this is you are isolated for about 2 weeks. We certainly need to notify public health people of this because it's unusual. I mean, you have to do that because we're trying to stop the spread. But individual patients then have restricted activity or isolation for 2 weeks once that infection is identified. So it becomes disruptive, and I think the idea is to try and avoid that as much as possible. So be on the alert, identified cases, that so far we've not seen any hospitalizations or deaths as a result of these infections. There's a little bit of experience with people with HIV and AIDS, for example, and while they may feel sicker and be sick for longer, there isn't any difference, at least at this point, in terms of outcome. But one of the things we're going to learn in all of this is how immunosuppressed people react to this virus, and if there are any differences in those people with immune suppression versus normally functioning immune systems. So we'll learn about how this virus behaves in different populations of people, because we are seeing community spread here. In other words, if people have traveled to other places and acquired it at some of these large events that have been reported to be the origin of this, and people come back to where they live and may spread or transmit virus within communities. So that's another example of something we want to try and mitigate, bring under control, and manage. It spreads with close contact, intimate contact, skin-to-skin contact, the kind of contact you have when you have sex. That there's a lot of rubbing of skin, and these lesions, as you see in the photos, the wet early lesions have virus in them. So with skin-to-skin contact that takes place, and I'm using sexual contact as the example here, is you rub it on the skin of somebody else, maybe abrade the skin a little bit, and it sets up housekeeping in this other person. So it's person to person, close contact, skin contact. Sexual contact seems to be one way of spreading this. And I want to make the distinction between sexual contact and sexually transmitted. That sexual contact, we've just talked about the rubbing and close contact that goes into that. That seems to be the way this is transmitted. There isn't any evidence that this virus behaves like the AIDS virus. It does not, and is not in semen or blood. So the early returns they're making a distinction right now about sexual contact, that kind of close contact, versus sexually transmitted. Yes to sexual contact, not that we know of, to sexually transmitted. I want to avoid stigmatizing people here. And that's been a big focus of the discussion. How do you get the message out in ways that are meaningful and understandable to people without stigmatizing another group of people? So we talk about populations who may travel to large events where partying and sexual behavior are part of the event, and then bring that infection back. Meeting people on social media apps and having sexual contact with people who you're not familiar with. Or traveling to a country where monkeypox virus has been identified. So as of the moment, a large percentage of the people reported with this infection are men who have sex with men. But as we've seen in past pandemics, when things are transmitted by sexual contact, then people who have sex are at risk here. My take on all of this is we need to wait and see here, because this appears to be very early in the course of this outbreak, and we have to see what's going to happen before we can say one way or the other that it's one group or another. But I'll tell you one thing, I'm certainly letting my LGBT patients know, my patients who are men who have sex with men, know what to look out for. The call was the White House Office of Public Engagement has a number of constituency groups that they work with. And one of the groups, the group that I'm in, is this LGBT Health and Advocacy group through the White House Office of Public Engagement. There are probably 150-ish people in the LGBT group. But yes, I was on a phone call with Dr. Rochelle Walensky from CDC Director, Dr. Dimitri Daskalakis, who's their prevention guy at CDC, formerly from New York City, and my longtime colleague, Dr. Tony Fauci, along with 100 or so of my colleagues who are doing LGBT healthcare and advocacy work. And we talked about a number of things. One was how to get the message across without misunderstanding or giving people the wrong impression. Because if you make it sound like it's men who have sex with men, then other people who may be at risk miss the message because it's always somebody else's problem. We made that mistake with HIV very early on and don't want to do it again because it distorts the message. It's misinformation. This is transmitted through sexual contact. I'm going to leave it at that for now. The other thing we talked about, though, was getting the word out to people, including men who have sex with men, people in LGBT health clinics, and getting the word out and encouraging more testing be done. Getting testing underway has been is always a challenge in these kinds of public health events. It happened with COVID, happened with HIV, and it's happening here. But we've learned something from that, so they're going to try and move that along so that more testing is available faster. And then the other thing we discussed was vaccine. What's the story with vaccine? There is a vaccine approved in the United States for both prevention and after exposure, pre and post exposure prevention of both smallpox and monkeypox. And the United States has about 110 million doses in the stockpile. So we have to prioritize while we're waiting for more vaccine to be manufactured, and at the same time discussing, well, who are candidates for the vaccination? Who are we going to vaccinate? And for starters, we're looking at animal care workers and people in healthcare workers in areas where cases have been identified to try and get ahead of it, to at least prioritize and use the 110 million doses that are available, use them wisely. So stay tuned in terms of other vaccination recommendations that will be coming. They're coming down the pike at some point, depending on the nature of this outbreak and how it continues and how long it continues. And we will see recommendations for vaccination. So the big issues are then getting the message out in a way that's meaningful and doesn't distort the message. More testing of people with even suspicious skin lesions, and the use of vaccination. Yeah, the test exists. It's a two-step test. That's why it's a little complicated. The state lab, New York State lab, tells you if it's the orthopox family, and then it goes to CDC and they tell you if it's monkeypox, yes or no. What we want to do is do that same testing method locally through hospital and commercial labs, so that it doesn't take so long, so that you get answers that are faster, more meaningful, and opportunities for stopping spread. But if you suspect somebody has the rash of monkeypox, they need to be isolated pending laboratory testing. Yeah, I'm on the alert, but not on edge. I think that we have learned enough from past pandemics to be able to look at this intelligently. And remember that not all of these viruses are transmitted in the same way. What we're seeing here is 3 different viruses: the HIV virus that causes AIDS, the coronavirus that causes COVID-19, and the monkeypox virus. And they are all transmitted in different ways, so that the way you approach this in terms of what do you do to stop the spread, protect people, etc., depends on the pattern of infection and the way that virus is transmitted. So HIV, transmitted through sexual contact, because it's in semen and blood. So semen, blood, needles for HIV, fairly close contact. Coronavirus is an easy one, and a dangerous one because it's respiratory spread. Small particles can infect large numbers of people, different than the AIDS virus. And this guy, monkeypox, takes a little more effort to spread from person to person through close contact. You have to have contact with those skin lesions that have virus in them, abrade your skin by moving around and all of that, and get infected that way. The African version is a different way of spreading virus, and that's from animals to humans. This is different. What we're seeing now with this monkeypox in non-endemic countries is from person-to-person contact.